Eric Kammer here, registered physiotherapist. Today I'd like to talk to you about some of my favorite shoulder mobilization exercises and range of motion exercises that I like to have patients perform when they're transitioning from active assisted or passive type mobility exercises, right? Where, for example, you're using your other arm to bring the affected arm up, where we're kind of progressing to more active range of motion, where you're really trying to utilize the muscles to do the movement, right, actively on its own. But before I continue, please hit that subscribe button below so you'll be notified about any new videos I have here on my channel. So what I want to talk about today are they're called walk-up exercises with your hand. And so what I'm going to show you here is two specific exercises. One, to walk up the wall doing flexion, which is essentially this movement out in front. And then the other one for abduction, which is where you're bringing the arm essentially out to the side. And as I mentioned, these exercises, I tend to use them when the patient is in that in-between zone where, perhaps we're starting to build up a little bit of strength in through the shoulder or the rotator cuff muscles through perhaps some isometric exercises where we're doing little pushes. But the patient still doesn't have the ability, perhaps the range of motion and the strength to be able to do this actively. But when they're using their other hand, they can go, fairly close to full range of motion. So at that point, I really like to start to introduce these hand walking type exercises. So essentially what you do, and I'm just going to show you on this wall here, but the idea is that you place your hand on the wall, okay, and you're going to walk up the wall with your hand. And then from there, you can either walk back down, or once you reach that kind of level to as far as you can go, you can actually use your other hand then to bring it down. And so that would be more for flexion, right? So when we're walking up straight out in front. Now for abduction, which is where we're kind of on the side here, you would start then on the side of the wall, and you're gonna do the same thing. I'm just walking my hand up, and then I'm going to walk the hand down, or again, use my other hand to bring the arm down if that's an easier transition. If you have any questions or concerns, feel free to leave a comment below, and please check with a physiotherapist to make sure that this exercise is appropriate for you. Thanks again for watching, and have a great day. Take care.